The other area that Chile innovates in is in family medicine and community medicine. And so I would try to get a group of students, and we were limited to only 15 students, that included physicians in the MPH program who were interested in community medicine and family medicine, rather than going into specialties like surgery or oncology or any of those. They're the family medicine doctors that now we need in Obamacare, the kind of primary physician who knows a lot about different specialties but works directly with families. And so they have an innovative program in that. And so we bring in students that do that. So we've got a combination of the broader policy health reform issues with community medicine. And an innovative thing that we did with one of the universities there, the family medicine residents were allowed to join the course. So we'd have 3 to 5 Chilean residents who would be in the course with us, and they, of course, would get to know these students and they'd spend social time together, and they really made the course a much more living kind of experience for the students. Over time, of course, now we're looking at the implementation and not so much the basic decisions, but it's a really interesting, exciting course. Up until last year, I usually got about 40 applicants for the 15 positions. Something strange happened last year because I got 15. But they worked out fine. It worked out to be a very effective program, and we'll see next year if we get back to the same choice. But it's a course that doesn't require you having Spanish, so a lot of the Chileans speak English, but I try to balance it so that there are enough Spanish speakers in the group so that they can do some of the translating if they need to have it. And so it's a really very wonderful, and I certainly enjoy spending 3 weeks in January in the middle of summer, right? And they do too. And we sometimes go hiking in the Andes and do some of those kind of taking advantage of being in an interesting another country. We're always in the learning stage. I mean, I don't think, it actually is one of the themes that we use in almost all of our training programs at the School of Public Health. They're probably, for many of the kind of things that we're talking about health systems and about what kind of professionals ought to be trained. There are no right answers. We don't have enough evidence that there's one way that works better than another. There are contingencies, and there are different contexts in which something might work better than another. And we're trying to develop more evidence that would support one method or another. But so far, the jury is out, partly because we spend a lot more money on giving services, whether they're working or not, than trying to find out whether they're working right. And I'm an academic. I have an interest in trying to do more research. So I think we don't know. I think theoretically some of those ideas look good and they're interesting. And I go to my family physician, my primary physician. In the United States, we're trying to emphasize more of that. I've also been seen some of the negative things of strong specialties. If you go to a specialist, they try to solve the problem that they know, but you might have something else. I was a doctoral student in the political science department at the University of Wisconsin, and I had to do work on my dissertation. And I started to do a dissertation on the copper industry, the international copper industry, and that got me interested initially in Chile. But On the advice of one of my professors, I decided that it would be more interesting to study the democratic road to socialism, which Salvador Allende was trying to implement, and that it would be quite exciting and more interesting than a dull thesis on the industry, the copper industry. I went there initially. My own beliefs were more on an anarchist side at that time, and I was trying to criticize the Allende government from an anarchist perspective, which was not in the coalition that was in supporting him. But when I watched what was happening there, I decided that it was tough enough to try to do it the way he was trying to do, and I decided that anarchism was not the way to go, and that I became actually much more of a Marxist and supported the general perspective and the basic arguments that the Allende government had. And I was there for 9 months during the last government of Allende. And I left Chile because my mother was dying of cancer, and they called me and they said, if you want to see her, you have to come back. And fortunately, I got out of Chile just 3 days before the coup that ended the Allende government. I never returned to Chile until the end of the military dictatorship, which was 18 years. But I still, kept in touch and tried to see what was going on there. By the time I came back to Chile, I had shifted my interest and career to working more in the health sector and looking at health issues and health policies, which is what I do now. And so when I came back, I was looking at the different policies that they were doing in health and helping to support them and evaluate the programs that they were doing there. When I saw what was happening in Chile, and that, the people that I was more sympathetic to were on the far left of the coalition that supported Allende, and saw that by pushing a political system toward the objectives that you were working toward very fast, that you could generate quite a hostile reaction, and that it would be better to try to persuade people and to slowly move closer to what you wanted to do in order to avoid the kind of disaster that happened in Chile during the coup. And in the course that I teach in Chile, we had one fairly long session with one of the ministers of health, and he told the students, he said, be careful with your democracy. He said, we thought that we were going to be democratic forever. And we didn't really understand that we could push too hard and that we would live through a dictatorship. And that if you're in a political system that moves toward a more polarized situation where some people believe they're the only ones that know the truth and that the others are evil, that you undermine the consensus that could lead to some kinds of positive changes, which makes me worry about the United States to some extent, because we are polarizing in ways that are not as extreme as what was happening in Chile, but still threaten and the underlying need to work toward consensus and to work toward compromising among the different positions that people have. And so that experience has made me much more cautious about what I think we ought to be trying to do. And that the costs of trying to get what you think would be a better system, and to do that quickly without sufficient support in the broad population can lead to a disaster. The Chile Course, we call it the winter term course in the summer in Chile, right? Because of course, and that's one of the advantages of this course. There are at the School of Public Health during what they call the J term. It used to be called the winter term, in January. 3 weeks at least. There are a variety of courses that are offered, and students are, in a sense, required to do something during that period, usually travel and go to different places. They try to emphasize that this is an opportunity to see things in practice rather than stay in the classroom, and to work, to go to other countries and to actually see what's going on. So Chile, before I started the Chile course, there was a course in Kerala in India, and a course in Cuba. So the students asked me, and the school actually asked me to develop one in Chile, because I had been working in Chile for about 10 years. And I knew a lot of the people involved in the health system and health care, and I knew the ministers, the former ministers, and I knew people that were working and observing, and academics that were working on it. So what we did was we developed a course with two students who were here, who were Chileans, to work with them in Chile and have students come in and look at the reform efforts and the health system by interviewing lots of different people. And we were lucky the first year. The first year was the first year of when the first law was passed for this innovative reform. So there was a great deal of excitement, and there were lots of people that were talking about what they wanted to do and what they thought this would do. And there were the medical association was very much opposed to this, so we would interview them and they would tell us how awful this thing was. And it was very good, because I tried to step back. I didn't try to tell them what I thought it ought to be. I wanted them to have an experience of, like a consultant. You go into a country and you try to find out what the truth is, and you interview people and you find out what's going on.